So welcome, Dr. Earl Turner. It's thrilling to have you here for Gay Sons and Mothers. And you know me, that I am Rick Miller, and I am in charge of Gay Sons and Mothers. And I'm happy to say that we are so fortunate to have you on our board.
I'm
Maybe you can
excited.
tell us a little bit about who you are and what your areas of expertise are.
Sure. So I am a psychologist here currently in Los Angeles, California. I also teach at a university here where I primarily am involved in the supervision and training of graduate students that are training to be therapists and psychologists. So within our master's program, as well as our doctoral PsyD program here. And so a lot of my work is centered around multicultural issues, intersectionality, and my research focus is on primarily looking at African-American or Black mental health and looking at barriers related to treatment seeking with that population.
Yes. And you've done a lot of writing on this topic, and you've also recently come out with a book that I see over your shoulders.
Yes.
And it's showing up backwards on my end, but it's called Mental Health Among African Americans. And I think that your work is making a huge impact on the field of mental health. And it's very exciting to have your work out there, but also for me to have a personal relationship with you. So welcome. I have a few questions for you that I'd like to ask as they pertain to the relationships of Black gay boys and Black gay men from a community perspective, from a mental health perspective, whatever it is that you have to say. So my first question is if you can describe the prevalence of homophobia in the African American community and how it exists and why it exists.
Yeah. Well, I mean, I think, obviously as the larger society, we've seen shift in terms of openness around homosexuality or being gay or lesbian, that within multiple cultures and communities, there's also been some changes. So I think within the Black community specifically, and I'm going to use Black to refer to multiple aspects, so not just African Americans or Blacks that are born in America, but also those that may have come from other countries that are now within the United States who are perceived as being Black regardless of what their nationality is. And so I think those are important characteristics that need to be sort of recognized.
I appreciate your specifying that. That's a question that a lot of people have, so that's helpful.
Yeah, and so I think like within the Black community that there's a lot of things that focus around sort of marginalization related to homosexuality. There is some strong religious or spiritual beliefs in a lot of communities.
Yeah.
And so I think that also shapes people's acceptance related to, Black gay men or youth. And so I think that has carried over for a lot of families in terms of one wanting to have concern for how their kids may be treated. Obviously, this idea about sort of fitting in within the culture and at the larger society, how we think about sort of masculinity. And so I think that also, impacts, some homophobia within the Black community. But also the concern for, I think, a lot of parents about, the safety of their kids. And so we know that in terms of like hate crimes related to gay individuals and specifically, gay men, that for Black men and Black youth as well, that there may be additional concerns about that for parents. And so a lot of, I think, the difficulties with acceptance may really focus on, I really want to protect you as my child, and also understanding that people you have this sort of double sort of aspect of things against you, because as a gay person, but also as a Black person, that they're gonna oftentimes physically see you as sort of Black in terms of your race. And so that's an additional factor when it comes to hate and discrimination.
And also, so many of the people that I've interviewed for this project talk about growing up gay and how difficult it is in the communities that they are raised in, and that the gay community itself can be racist at times, and that makes it challenging within the gay community because people are seeking acceptance from us, meaning the gay community, and not always receiving it. So,
Yeah. I think sort of one other thing that you sort of touched on in terms of discrimination within the gay community and specifically sort of towards Black males is that there's also dynamics of those that may not be like fit these sort of stereotypical
yeah,
aspects around behavior,
yeah,
and also those that may be identifying as bisexual that
yeah,
have additional challenges in terms of
yeah.
sort of acceptance within the gay community as well.
So what you're referring to are norms in the gay community as opposed to the Black community. Okay, just wanted to make sure that people understood that. Can you also talk about coming out? How is it difficult for a gay Black boy to recognize within himself that he may be different from who his family wants him to be? And, coming out is a process that is both internal and also external. And by internal, I mean reconciling within himself about who he is, and external is who he decides he's going to share this information with.
Yeah. No, I think sort of one thing that oftentimes may come up around that is just sort of this fear of acceptance. And so within the Black community, sort of family and community are really important. And so some fears for a lot of Black boys and even men as they get older about coming out is that, am I going to be rejected? And
Mm-hmm.
so we know that the research really speaks to that there's a high rate of rejection
Yeah.
among Black men and youth specifically within their family systems around this. And so I think that is a big concern for many in terms of that coming out process. And then the second thing I think that factors into that is about, how do you navigate for yourself ideals around masculinity norms, and that there's also sometimes like self-hatred
Yeah.
about sort of if you are gay, do you have to be a certain type of gay, so to speak, and that also factors into how you may be accepted or not accepted as well. And I think that for some boys specifically, that there may be concerns about, if I am not as masculine, that people are going to be less likely to accept me, but also how is it going to impact my other relationships in terms of like I think conversations around sports have come up often. And so for Black boys who are athletes and that are into sports, how
Yeah.
is that going to impact those sort of opportunities or activities if they do decide that they're going to come out? And so that sort of disclosure is really important in them deciding, when
Yeah.
do I disclose, who do I disclose? And
Yeah.
obviously, as we know from the research, that coming out process is not just a one-time thing. It happens over multiple, incidents.
Mm-hmm. So you're touching on masculinity, which was my next question. And you and I actually met. We were both speaking with Esther Perel on a day-long conference on masculinity. And can you speak about how masculinity is translated and what the expectations are in the Black community around masculinity?
Yeah. I think like one of the things that oftentimes comes up is that within sort of Black masculinity, and so thinking about masculinity norms within the Black community,
Mm-hmm.
that oftentimes even, things that may be non-controversial, such as being emotional,
Wow.
may be sort of characterized as being, feminine or being a sissy or some of these other derogatory terms. And so I think for a young boy that grows up hearing those types of messages, that it makes it much more difficult for them to be comfortable sort of accepting themselves and wanting to then, come out because they are going to like, there's fear of being, characterized in
Mm-hmm.
that manner. So I think that oftentimes, impacts, their willingness to come out, even though they may sort of be masculine in terms of those traits. People are going to make assumptions about them based
Sure.
upon, their sexual identity.
Yeah.
And then the other thing that comes up, I think, is that because of these norms within the Black community, as well as within society, that those that may have some additional concerns about sort of masculinity norms may also begin to experience internalized, homophobia
Yeah.
themselves. And so there's that hate
Yes.
about, who they are as a person, as a result of either they may sort of, even though they may be masculine in some of their behaviors, because of how society oftentimes views, being gay, and specifically in the Black community, then they may also internalize some of those negative messages as well.
Sure. I do a lot of work around issues of masculinity and the internal holding back that takes place for people, and the ways in which people are not even consciously, they're unconsciously holding themselves back. So even when they come out and they're living life as an out gay man, they're still holding themselves back based on years of conditioning of being
Right.
careful. So I assume that that is a piece of what you're referring to.
Right, exactly.
Yeah. I'm also curious about the role of mother in the Black community, and I'm asking you this based on the fact that with this project, Gay Sons and Mothers, I'm hearing a lot about the roles that moms play in their kids' life, both around acceptance of him being who he is, even if he's not out. A good mother supports her child and lets him be whoever he is in the world, just because that's what a good mother does. But frequently, a lot of the moms that I've spoken to, and also the sons in describing their mothers, have spoken about the ways in which she has advocated for him in the family and the extended family. So I guess I'm curious about what some of the cultural norms are about this.
Yeah, I mean, I think, for most families, the idea of mom sort of being that nurturing person oftentimes comes up in, any family, regardless of their ethnic or cultural
Yeah,
background. And
yeah,
so I think that is, something that is consistent within, Black families as well. And oftentimes I think when it comes to the parenting aspect, like that relationship with mom is really important to how you grew up as an adult, and
yeah,
sort of how you treat others, and specifically, your partners. And obviously, for gay men, their partners are also male. And so I think that that relationship between a mother and son may also play roles in terms of, same-sex relationships, as well, in terms of, communication or, intimacy. So when you talk about, was mom able to like engage in, hugging and those
yeah,
types of things, like, does that impact, when you're in a relationship with your partner, like, are you comfortable being in that sort of, intimate nature or closeness and hugging, or do you prefer to like have some sort of distance? And so I think those things might also,
sure,
factor into some of those sort of romantic relationships as well. And so I think that's a big part of how, the role of the mother is really significant, in the life of a son, but more specifically the life of a gay son.
well,
And oftentimes having the mom, there are conversations around like mom always knows, and sort of whether mom is vocal about, that or not, I think sort of, differs among different family systems. But
yeah,
if mom does know, and maybe sometimes mom knows and dad doesn't know,
right,
that mom may be the person that has to serve as a buffer in
yeah,
terms of getting dad to sort of be on board. And I, in my own clinical experience working with gay youth, have, seen where, moms have been really instrumental in addressing like the mental health aspect of it, and understanding you when it comes to like suicidal, behaviors or thoughts, that mom is oftentimes more understanding of what's that connection between this sort of poor mental health and the
mhm,
acceptance of coming out process. And
yeah,
dads sometimes may struggle until it gets to a more sort of crisis level with mental health, and then they may sort of understand the dynamics of the difficulties that their child may be experiencing when it
yeah.
comes to, coming out and acceptance.
Do you see mothers being more actively involved early on in the process, and then fathers come on board? And I realize I'm making generalizations here, but
Right. Yeah, no, in my experience, I've definitely seen mothers be more on board. And so, and specifically relation to, I've done some outpatient clinical work as well as inpatient work. And so for
yeah,
my patients and families that I worked with where their child was admitted to, hospitalization inpatient because
yeah,
of risk, oftentimes mom is really on board with like the treatment planning and the safety planning around, suicidal behaviors, and trying to prevent this sort of reoccurrence of behaviors. And not that dad isn't on board, but I think fathers, from my experience, have a much harder time with understanding, why would you want to result in like harming yourself just because of, the difficulties with coming out process. Whereas I feel like mothers, from my experience, have been more likely to sort of recognize like this is a really tough life decision, and because of bullying or lack of acceptance or whatever the concerns are, that it does have a strong impact in terms of mental health.
Yeah, thank you. What supports are out there that you're aware of, both for mothers, for family members in general, and also for sons?
Yeah, so I would say like the Trevor Project has a lot of resources that are available for families. And so, parents and youth can go to their website, the Trevor Project, to find information about their crisis line. They actually have which I just recently came across, like a online handbook that talks about the coming out process. And I think for parents specifically that may not have as much knowledge about, coming out, about, gender identity, sexual orientation, sort of that educational aspect of it, I think is really helpful for a lot of families. And so that's a really good resource that they have on their website as well. And then I think just trying to find support groups for yourself as a parent. I think there can be a lot of self-blame that may occur for parents in terms of, their child being gay. And so I think being able to sort of talk with other parents or mothers or fathers about sort of your own experience, I think is really helpful to help you with your own acceptance. And then that might also impact, your ability to be more comfortable having those discussions with your child.
Yeah. Also, let me put in a plug about Gay Sons and Mothers. What we do is we share stories of individuals, whether it be from the point of view of son or the point of view of mother, or sometimes both. And there's something about hearing people's stories that's both inspiring, relieving. Sometimes people feel like they're the only ones going through their particular struggle. And when they hear the stories of other people, it's so reassuring. So,
yes, definitely.
can you talk about, and I've read your work on this topic, about mental health for for the Black community in general, that it's something that's hard to access, it's not accepted in the community. And then if you can also break down the specifics for gay men and mental health and what some of those barriers are as well.
Yeah, so I think at the sort of larger aspects of it, if we look at barriers for treatment among the Black community, that oftentimes, finding providers is really difficult. And that can be a whole nother like conversation in itself to talk about all those barriers. But I think some of the things that might, impact it would be providers of color. Obviously, we know there isn't much diversity in the field. And if we talk about psychologists specifically, only about 4% identify as Black or African American. And so
I'm sorry, it broke up. You said 4%?
Yes, about 4% of psychologists identify as Black or African American. And so that in itself, if we think about across the country, that there's going to be, much more difficulties finding someone. And so I oftentimes will get, referrals for Black male psychologists or therapists specifically. And, that's even a much more difficult challenge because the field is predominantly, female.
Yeah.
Another factor that might be important when it comes to like being Black and also within the LGBTQ plus community is that, are there providers that also, identify from their intersectional perspective as being gay or lesbian, and that for some people, they feel more comfortable with someone that also identifies, within that community. And that can be an additional challenge for someone as well, in terms of that sort of therapeutic relationship that we know is really important to making sure that, people stay in treatment and that the interventions are also really helpful in terms of the approaches that we utilize to help people with their mental health.
Yeah. So obviously, the greatest support would be to be able to find a Black male therapist. And if 4% of psychologists, well, though that's not even gay male therapists, that's
Right.
Black male therapists. So the numbers are even lower, makes it hard. So I would imagine then, in terms of seeking a therapist, that the ideal, if there isn't a Black gay male therapist, would be to find a therapist who's sensitive to LGBTQ issues, who might be Black, or if not LGBTQ sensitive, and sensitive around issues around race and growing up in the United States, certainly,
Right.
and what that means.
Right.
That's,
And then also, I think thinking about, some of the other nuances that, as a psychologist that, or even outside of my expertise in terms of, sexual relationships and when we go into intimacy and those types of things, is that people also need to be mindful of, that continuing education and continued learning. Because I think if people bring up issues, in therapy around some of those things when it comes to sex, for example, that you may be uncomfortable as a therapist, or the person may not feel like you know enough, and they, I struggle sometimes when it comes to therapy that you put in a lot of burden on the client or patient to like educate you about certain things, and so I think that may be really difficult, for a client if they have to really explain some of the nuances about that, for families. And so I will tell people to, do your research. And if you feel like that person isn't the best fit, then obviously, ask for a recommendation,
yeah.
if possible, or, find someone else that may be a better fit for you.
And sometimes the best referral sources for therapy are from friends and people that you respect who have been in therapy and they're working with someone good. Nowadays, more and more people are looking on Psychology Today and larger listservs. And what you're getting there is a name and a description, which is fine, but a personal recommendation frequently is a much better way to find a therapist.
Mm-hmm. Yeah. And if you can't get that recommendation, I think it's important that you ask the right questions. And I think
Yeah.
sometimes, potential clients or patients are not comfortable or don't know what question to ask, or if it's okay to ask those questions. And so I think it's important for people to know that you should, ask a potential therapist that you may be interested in. Have you worked with gay clients before? Have you worked with Black gay clients before?
Right.
And what has been your experience with that population?
Yeah. What about family sessions? Have you done any family sessions with mothers and sons, or with gay sons and their parents?
Yeah, I have. And I would say most of my experience has been with adolescents or teenagers,
Yeah.
in terms of the family work. And so that can be difficult sometimes. And I think, again, like part of it may be just parents not understanding a lot around people's process of knowing that they may be attracted to the same sex, or being able to sort of, be comfortable with that coming out process, or dealing with, again, some of the religious, spiritual
Yeah.
aspects that may come up as well. And uh, focusing on sort of larger families, not just, Black families may be religious or spiritual as well. And that for white families that may, also be religious, that can impact some of the dynamics,
Sure.
with those individuals as well. And so I can recall a client that I was working with years ago where sort of religion came up in the session, and parents were really religious. The child wasn't as, wasn't very religious in terms of where they were in that process. Um, and so it was difficult because they kept talking around
Yeah.
a lot of issues and really not naming things that were related to, sexuality or him being gay. And so I think that can make, those conversations more difficult, and also make the adolescent, even an adult, not be sure how to sort of how their family members may stand in terms of like acceptance if you're not able to at least sort of speak,
Yeah.
honestly about these topics, whether you're afraid or not.
You're reminding me of a case, oh gosh, 35 years ago that I had. I worked with a woman whose son was out and gay, and I think he was in his 20s at the time, and I myself was in my 20s, and I was out, but I wasn't out to this particular mother. And she would come in each week talking about her heartache about her son being gay. She was very religious, and she referred to his being gay as his illness. And I used to be sitting in my chair in the office with her thinking, how am I going to kind of cover up that she may figure out that I'm gay, and what would it mean to her as a mother, where she has her own space of comfort to come in and talk, if she found out that I was gay. And one day, the clinic where I worked, her son came in for medical services, and I met him in the waiting room, and I was very worried that he might sense that I was gay and then tell his mother. I don't even know if the son knew that the mother was seeing me. I suspect he did, but I was scared that something was going to happen. She would find out, and that it would have an impact on her own views of treatment. But fortunately, we got along great, and it didn't appear to work out in a negative way. So
Yeah.
interesting how these things work out. I don't have any other questions. I'm curious if there are other points that might be important that I'm forgetting to reference, or anything else you'd like to share.
I mean, the only thing that I could sort of think of that sort of popped into my head is related to a discussion that I had on my podcast a while back. I don't remember now when it was, because it's been sort of a blur, but it was season 2, episode 6, and I was talking with a psychologist, Jonathan Lasseter, about sort of gay men, and specifically Black gay men, and what are the what are some of the language and terminology about identifying as gay, identifying as Black and gay, or identifying as same gender loving. And so I think those are things that, again, in terms of how do we refer to people and how people refer to themselves, might also be important to think about it. And I think for families and parents to sort of ask, you know, about some of those conversations as well, so that people, again, feel like you are open to, like, at least understanding who they are as a person, and that you're not really making these sort of broad assumptions based upon sort of misinformation that you may have obtained through internet or from others.
Yeah. And what is the name of your podcast, and how can people access it?
Yes, it's called The Breakdown with Dr. Earl. You can find information about it on Instagram at The Breakdown with Dr. Earl. And from there, you can be able to access my website, which can link you to all of the platforms that have it, such as, you know, Spotify, SoundCloud, Apple Podcast. And it's really geared towards focusing on not gay men specifically, but issues that might impact boys and men across the board. And obviously, you know, some of the things that we talk about are related to intersectionality. And so focusing on, you know, gay Black men as well in terms of their mental health.
Great. Well, you are an incredible resource for a lot of people, and I'm thrilled that you are part of Gay Sons and Mothers, and also appreciate this interview with you. Thank you so much.
Thank you for having me.
Take care.